Let's see. Trying to see if, okay. Yeah, it's just a slightly different with Microsoft Teams, but anyway, I think we should be all right. Okay,
Yep, we can see.
perfect. All right, I got that right. Once again, good morning. My name is Tariq Khanekar. I'm the Senior Research Coordinator at DuPage County Community Services. I work next door to Becky. By Senior Research Coordinator, I mean I'm the guy who works on DuPage CRIS. Now, some of you may be aware of DuPage CRIS from before. Maybe you've used it. It's the Community Resource Information System. It's an online database maintained by DuPage County Community Services for basic health, human, and economic needs, primarily for the community here in DuPage County. That doesn't mean that those who are outside DuPage County can't use it. You can use it, but at minimum, the resources and the services that are curated and showcased in the database have to be available to DuPage County residents at minimum. So let me see if I can. So the database has, I think, close to about 1,100 records. By a record, I mean basically a profile page that you will see. That's what a record means. Any given provider could have multiple records in the database based on how many locations they have, how many sites that they have. So I think with 1,100 records, that represents anywhere between approximately 500 to 600 providers in DuPage CRIS. They might be located here in DuPage County, all over Illinois, or sometimes even their national providers whose headquarters or offices are in other states. That can happen as well. This is just a graphic to illustrate to you what are one of the more practical reasons in terms of public service that we use something like DuPage CRIS and how that helps us. It helps inform us of what the needs in the community are. The more people use DuPage CRIS, the more we're able to mine the data. By data, I don't mean personal data. We just mean what people are searching for using DuPage CRIS. Are they looking for housing? Are they looking for assistance with paying for utilities? Are they affected by COVID and they're looking for related resources for those who have been adversely affected by COVID? So it gives us an idea of where to focus if there are resources in the database that are not sufficient to cover a certain need that we're seeing based on our research. Then we start parity projects to develop the database, so we include more of those resources. So we do this this report, as you see a graphical representation of the report we do annually to inform us. And so this is just a sample of what we do. In terms of those providers that I mentioned to you at the beginning, whose records are in DuPage CRIS, these are the primary targets are most of the time government agencies or nonprofit organizations. That's for the most part. There are exceptions to that rule. There are sometimes nonprofit organizations that we do include, but they have to follow certain criteria. So for example, in order to be entered into DuPage CRIS, your services, we have to make sure that either your services are available for free or they're offered on a sliding scale system, or that you accept government funding like Medicare or Medicaid. If all else fails, do you provide a service that is unique in nature and is not as easily available? Not too many other providers offer that service or that resource. So if you're deemed unique enough, then we will consider including you as well, even if your services are, you have to pay out of pocket for them. But those are few and far in between. These are some of the general areas that we cover in DuPage CRIS. Today, we're mostly going to be doing like a live demonstration on the site itself so that I can show you how to use DuPage CRIS to search for resources. And you will see a guided search structure in the homepage which better illustrates this. But this is just to give you a list of the major areas that we try to cover using DuPage CRIS: housing, disaster services, food, services for veterans, income support, mental health, which might be relevant today, um, and so forth. That doesn't mean every single provider record or provider in the database is neatly covered or neatly falls under one of these umbrella terms. Sometimes they're just outside, but most of them tend to fall under one of these. And this also is dictated by how we tag your resource records in the database. This is all also important. And I will show you what I mean by tagging a resource database, a resource record in a database. This is what the on the left-hand side here, this is what the homepage for DuPage CRIS would look like. This is the guided search structure that I was talking about. These are these buttons that you see right on the homepage. DuPage CRIS went through a design overhaul, I believe back in 2019. It was a little different before this. We tried to make it a little more user-friendly, a little more intuitive, because we don't make assumptions about um, the community at large that we serve. So we try to make it as easily accessible as possible. We try to use language that is neutral across the board, so that as much as we can, so that people find it easy to find what they're looking for. Oftentimes, people know what they need. To underline the obvious, people know that they need food or they need shelter, so they have an idea. Okay, this is what I need help with, but they don't know where to go. They might not know who are the providers in the county or who help or serve the county, no matter where they're located. So this is where this would help direct their searches and hopefully connect them with a provider who would be able to help them with what they need. You notice that in the homepage, there's a search, the keyword search option as well. So this is something that in this day and age we are most used to, given that we use internet search engines to look for whatever we need on Google or Microsoft Edge, whatever. It's important to remember that DuPage CRIS, while it is an online database, it exists online, and therefore that's how you access it. It isn't a search engine per se, like internet search engines like Google. It's an intranet, so to speak. So it's closed loop. So anything you look for using this keyword search option, it will look obviously within the database. It's not pulling in resources from the World Wide Web. It's not doing that. So that's important to remember when you're looking for resources using the keyword search, and it's not producing the results that you are intuitively used to today. So this is just an example of what a resource record looks like. So I've just chosen DuPage County Community Services record. All records across the board in DuPage CRIS are aesthetically the same. They would appear the same. It doesn't matter if you're DuPage County, if it doesn't matter who you are. If you're a provider who's represented or curated in DuPage CRIS, your resource record would look the same. The name will appear on top. You have the address, the phone number, a link to your website, and then you have another section. So here I've broken down, if you click on about this provider, if you click on that little button here, it reveals more information. And this is what that information means. So you'll see things like a description, which is just a summary. You have the hours. Again, it seems obvious, but the hours are the hours of service, not the hours of the facility. Those things aren't always the same necessarily. So it's important to distinguish between the two. The intake process is basically telling you, how do I access the services you provide? Do I have to make an appointment? Do I just walk in for services? Will this be over the phone? Of course, in the COVID era, which we're still in, over the phone services, remote services, services through Zoom, etc., have become more and more common. So this has also changed the landscape, so to speak, of public service or social service. Program fees. Now, DuPage CRIS does not put in dollar amounts if there are any self-pay options. It doesn't tell you this is how much it would cost for you to get the service hourly or whatever it might be. If it's out of pocket entirely, it'll tell you self-pay, something like that, like a generic language across the board. If it's like if the provider accepts government funding like Medicaid or Medicare, it'll just say Medicaid, Medicare. It'll say, sometimes it'll say private insurance if it accepts certain private insurance plans. If it's like it says here, no fee, so it's free of charge as long as you all fit the eligibility criteria, which is right below. I mean, in this example, it's not the best example of an eligibility criteria section because living or moving into DuPage County, that's it. That's the basic eligibility criteria for this provider record or this provider. But that can the eligibility criteria can be more complex depending on the provider or the resource record in question. There could be various criteria in terms of age, specific locations that you live in, whether income limitations apply. You have to fall within a certain income bracket or federal poverty line, etc. So we try to summarize that here so that at least we're directing community traffic accordingly and optimally. So people know right off the bat, oh wait, no, I don't fit this bill. I don't fit the eligibility criteria. Or yes, I do. I'm going to give them a call. So we try to direct traffic that way. We just don't put in the name and yeah, this is what they do and leave it there. We try to narrow it down as much as we can within reasonable means. Languages, this is important too. Those of you who have used CRIS before or DuPage CRIS, sometimes we say CRIS in short, by the way. I mean DuPage CRIS. You might have seen in the languages section, it doesn't say English a lot of times. Sometimes you'll see that it does. There's some discrepancy there. So the rule is, and this is the policy, the style guide and the inclusion policy for the database, we don't mention English explicitly. We make an assumption, a safe assumption, that all services provided in DuPage County and indeed in Illinois, at minimum, are available in English. So we try to point out whether services are available in languages other than English. Maybe it's Spanish or Urdu or Arabic, whatever it may be. If we have that information, we'll try to list it here. In this case, we also point out that we can use language line at DuPage County to help you if you don't speak English or you don't speak Spanish or any other language, that we have staff on hand to help you with. We can call language line and we can have an interpreter on the side to help us help you. If you see English popping up for certain providers, that is something we may have done in the past when we were considering whether we should include it. But as we go along, updating the resource record, which we do all the time, we will be removing that. So you shouldn't be seeing English as time goes on. Those should be cleared out. Moving along the resource record, you'll see other information. If there are other records within the database that are associated with that record, like I said at the beginning, if you remember, a single provider or an organization could have multiple resource records like this in DuPage CRIS. That could be dictated by whether they're at different locations physically. Sometimes it also depends on the service, but most of the time, whether they're located in different places, then we'll create separate records. Sometimes there are, especially with municipal records, like townships, villages, we'll create separate records for each of the departments. That's an exception. That's mostly applicable for those municipal records. That's just how we've done it in DuPage CRIS historically. But for the most part, a single provider or organization will have multiple records if they are at different locations. Phone numbers, fax numbers, if they're still there, general emails, if they're available, will be included as well for your convenience. So you can reach out to the appropriate number or send them an email if that's what you desire. Now, when you scroll further down, again, this is important too, you'll see these blue boxes. And the blue boxes will have these labels, which looks like services, right? It'll say, oh, clothing vouchers or gas service payment assistance, etc. So when you click on any of these, it should reveal more information. It'll tell you a little bit more. Sometimes this information is almost exactly the same as what you saw under that about this provider section, which I showed you at the beginning. But sometimes it doesn't. There are times when things like hours, intake process, required documentation, these might be very specific for the service in question that we're talking about, which is listed under one of these blue boxes. So we will try to, as much as we can, to provide that here for you. Especially if you think about required documentation, this can be very important. Um, if somebody is coming into, say, DuPage County at 421 North County Farm Road, because they have an appointment, they're going to speak to one of our staff to see if we can provide or we can connect them with services that they need. But they weren't aware that they should bring their insurance card or they should bring their ID. Now, again, I know this is a sort of like a stretched example. We all are intuitively, we carry our IDs, but again, that's not an assumption we make. We have to remember that we serve a community in general, members of whom might not make that assumption. Oh yeah, I should carry my ID. So it might be difficult for them that they've made the trek all the way to the county office, and then we're going to send them back that, oh no, you don't have your documentation. That can be difficult. That can be frustrating, especially when a situation where an individual doesn't have a lot of money to spare like that. So if we have this information, we try to include it here so that people are as prepared as possible, whether they're coming to us at DuPage County or going somewhere else for services and they have an appointment or they're going for an intake or an interview, that they have what they need with them. So we try to include that. There sometimes will be information like geography served. So if there are specifics like, no, we only serve these townships, or you have to live within the zip code. If we have that information, we'll include that here. Again, that helps those who are looking for those services, even providers such as yourselves. If you're looking at a record or for information here in DuPage CRIS, oh, well, I'm not going to send my clients or my patients here. They're not going to be served here. Only primary services are indexed in DuPage CRIS. What I mean by that is a service that is available to you so long as you fit the eligibility criteria, and the program fee structure, that all that fits, that's available to you, that's a primary service. Better yet, a contrast would be a secondary service. So for example, if say you go for counseling, you go for counseling in an organization and you might have children, you might have dependents. So for those who are existing clients for counseling at that organization, you can have your children be looked after for the duration of your stay there, for the duration of your counseling session. There'll be professionals there or staff there, and there'll be arrangements for your kids to be looked after while you're there, maybe an hour or a couple of hours, and then you pick them up and you go home. Now, for that provider or that provider's resource record in DuPage CRIS, it would be wrong for us to list childcare provider or childcare as a service, because that's a secondary service that's only available to those who are receiving primary services already, not to the general public. I can't call them and say, hey, I want to sign up for childcare. No, they're not going to do that. So that's an example of a secondary service. I mean, granted, that can be a gray area sometimes, and we have to, sometimes we do struggle to label something as a secondary service. Now, most of the time it's straightforward. Sometimes that can be difficult, and we've had conversations with providers trying to understand whether a service is primary, secondary. But for the most part, that is the rule. Only primary services get tagged. Now, you've heard me use this term, tag a service, or properly tag a resource record in the database. What I mean is we try to match the service a provider provides with what we have in terms of service terms in the taxonomy tree or the service tree. The taxonomy tree is maintained by 211 LA County taxonomy, or 211 LA County rather, that is used across North America. in Canada and the United States by those providers or organizations such as ours, or including like 211s who have resource databases, and they provide services to the community that they serve, and they use a resource database to connect um, community members to the services they need. So they all follow this taxonomy. That's just a library of terms, service terms that are arranged in an alphanumeric system, and you choose the correct one to match with the services that's provided. In other words, when I create a resource record in DuPage CRIS for a provider, I cannot customize the service you provide in that little blue box. I have to choose a service term and match it. This is so that we can be consistent across the board in how we label services, and our understanding needs to be as much aligned as possible to how we tag things. So if across the board, we should be on the same page as much as possible about how we tag counseling services, how we tag substance use or substance abuse services. And there are various kinds, and you can go to various levels. It can be higher level or it can be lower level. Let me just, and this is important to illustrate because a lot of times we're having conversations with providers who have records in DuPage CRIS, or for whom we're creating new records. And we're having this interview, we're having this back and forth, and we're trying to understand what is the service you provide. And I'm asking all these questions, and it can be annoying. Like, man, how much do you really need to know? I'm just trying to find out what it is so I can tag it properly. That's important. That step is really important. That's why it takes time. So for example, this just illustrates a situation where we attached WIC applications or WIC certification to a resource record. So that's that blue box right there that you see, which we illustrated before in an example. And you notice that there is a service term you see below, that there's an alphanumeric code, so to speak. And that's just a code. We didn't create that code. That's just a code in the taxonomy tree, in the service tree, that gets tagged to, that has its own definition, that exists, independent of, we can't edit or we can't alter that definition or how that term reads. All we can do is attach that term and then fill in these details that are specific to this provider. That much we can do. So then when people are looking for WIC application assistance or WIC service, whatever it may be, they're looking for WIC in DuPage CRIS, this provider record or this record shows up. That's why this is important. And that's why getting this right as much as possible is important. What I want to do now is I want to go into the live site. So I'm going to change my screen view and go to another window. So give me a second. Let's see. Now, count on me to have too many windows open and not be. Okay. Just bear with me. There might be you might see a different window when this first starts, but I'll change it. Now, Becky, do we see the DuPage CRIS site?
Yes, we do.
Perfect. Okay, I haven't messed up too much.
You're still good.
Okay, thank you. All right, so let me see. I'm just trying to move my share screen option so that I can see this better. Okay, that's fine. So again, this is the for those of you who are able to just open a browser, you can if you want to, if you want to follow along. So it's dupagecris.org. That's our site. So that should open up. And let me just magnify this a little bit. So this is what you should see. This is the DuPage CRIS site. This is the guided search structure that we talked about before. So let's look at a few examples of how to navigate the system and how to find resources. So I do have a basic idea of some of the areas that you guys have expressed interest in. Some of those have been kind of general, and some of them are more specific. So let's start with a few general ones. So given the audience today, I would assume health, wellness, and dental would be an appropriate area to start with. So that you click on that. Once you click on it there, you see a list of other subcategories. So you have community health clinics, dental care, support groups, other support services, hospice and palliative care, etc. All that way to medical expense assistance. So these, when you click on these, they should reveal a list of providers that we have in the database. So if I click on community health clinics, so it looks like I get 26 hits for resource records, right? And then you scroll down. Now this view is it just gives you a little bit of a description, a list of the services provided. This is not the best view, but this is just a summary view, address, phone number. You need to click inside, you need to click one of these to then show you the provider record. And there you have it. You have the provider record. You notice here, this is similar to what we saw before. You have the name, you have the address, phone number, you have the map on the side. Again, disclaimer, the map, this is just connecting to Google Maps, of course. We don't manage the map, we just connect to it. So as long as the address here is correct, it should show up. But there's nothing we can do about that. You click on about this provider. Again, there's information as you expect. There's an overall description of what they do. These are the hours of service that are listed as far as we can tell. This is probably a better example of program fees, sliding scale, Medicaid, Medicare, all kids, private insurance. Intake process is very basic here. It just tells you call or visit the website to schedule an appointment. If applying for sliding scale fee, documentation will be needed. Languages, Spanish, Tagalog. So, this is what we would expect. One thing that I didn't mention before is important to remember: the date of official change. Now, this is the date that the last time that we reviewed all the information in this record from top to bottom, preferably with the provider themselves. Usually there's a resource contact for us in place for any given provider or provider record who we can reach out to once a year. We email them. If they don't respond to the email, we try to reach out to them by phone, ask them to review the information and let us know if any changes are needed, whether your phone number or your address has changed, etc. Or your services are different now, something has to be changed. We do that. We want to make sure that the information is accurate. So that then we do the review. That we call it an official update or a formal update or an annual review. So that's done. When that's done, the updated date should show up. So the date of official change. So this record was last officially updated, fully reviewed on July 15th. Why do I blabber on about this? Why is this important? Because say you're looking at information here and you say, wait, this is old information. Sometimes you will see old information in CRIS. It is not in real time up to date all the time. That's why I give you that date, that was the last time we reviewed this. Now, the only way we will know if information is up to date or information has changed is either it comes through the grapevine, we get like a newsletter update, or we hear something through our social media feed, or the provider is kind enough to call us or email us to let us know, hey, we need to change or update this information, or they submit a change request. That's the only way we'll know. We don't have enough manpower to around the clock every single day review every record. Remember, we have close to 1,100 records in the database. That's not possible. So this is a disclaimer to you when you're using DuPage CRIS, that look at this date, and sometimes you might see information that's out of place or not quite up to date. That is expected. Is it ideal? No, but it's expected, so that you know. And then the expectation is that providers, even if you're not associated with this organization and you know that information needs to be changed, you can always let us know. You can get in touch with us, but I'll tell you more about that later. Again, these are primary services that are listed for this record. Like I said before, you can click in here and it'll reveal more specific information about the service in question. This is just one example. Let me go back to the home page. Another thing we can look at, I know that specifically some of you have talked about, mental health and counseling. So there is a section for mental health. So you can click on that. And here, mental health also covers substance use treatment, substance use support services as well, as you see. So click on the main category and it reveals a list of subcategories. And you can click on any one of these. So if I click on substance use evaluation and treatment, again, it reveals what we have, that this one has 35 hits for us. That means the way that shows up is there is a service term, like I told you guys before. So if I click on, say, a safe haven, so all these blue boxes, these are service terms. If I click on that, notice here, ND 2000, you don't need to remember or memorize that code. But the reason I mention it is that as long as that's accurately tagged and the overall guided structure in CRIS, it knows that they will pull in anybody who has that tag with them under this substance use service term or category, they'll show up. That's why tagging resource records correctly using the correct service term is so important. And we're so insistent upon it. I want to show you another thing that we can do. So far, I've just shown you very basic examples of just clicking on a guided search option and just going through the motions and clicking on providers. That's the easiest way to find things and probably the best way to find services that you need. You can always also use the keyword search, but the keyword search can be tricky. So say I want to look for, you're looking for therapy. Some people just look for therapy. Now, therapy could be all kinds of therapy: physical therapy, psychiatric therapy, etc., etc. I'm not an expert. I'm just assuming there's so many kinds of therapy. So if I search for therapy, let's see what happens. I'm not exactly sure myself, so let's see. I search for therapy using the keyword search option. So I get 43 hits. Now, I'm not going to assume right off the bat that that means there are 43 service providers or provider records in the database that all provide some kind of therapy. I'm not going to assume that. There might be more to that. So let me see how therapy shows up here. I'm just doing a control F, if in case you didn't know the trick, to see where this keyword comes up. So sometimes it's straight up in the name: Center for Creative Arts Therapy, for example, compensated work therapy program, behavioral services, etc., etc., etc. So I see therapy showing up within the record itself. Let me see if it shows up here in the second page. Yeah, it's showing up. So this is one way you can make sure that what you're searching for is sort of adding up to what you need. Remember, the keyword search, it's not searching the World Wide Web, it's only searching the database. So it's closed loop. It's not really pulling in things that you would intuitively expect it to pull in. Google will obviously produce a different set of results altogether. This is also important to know because sometimes you will search for something and say you know about a provider who does this service or provides this service or resource and has been doing so for a long time. And then you don't find them in CRIS, and you, as best as you know, you expected it to show up in CRIS, but it didn't. We would want to know about that. We would appreciate it if you could let us know, hey, I noticed that you guys don't have provider A in DuPage CRIS. Would you consider? You don't have to be part of that organization, by the way. You could be any member of the community. Just let us know, draw our attention to it. So then we can add it to our assessment list and we can start researching and saying, okay, yeah, we should add that. That's a good catch. Thank you so much. This doesn't work unless that sort of cooperation. So that's important too. Don't expect to see every single provider that you would expect to see here in DuPage CRIS, because DuPage CRIS is still developing. We're always adding resources. We're assessing resources. So that's important to remember. Let me go back to the home page. Again, you just click on home on the top. If it wasn't obvious, I'm sorry. And it takes you back to the home page. One of the categories that I think is of interest for many of you today are services for adolescents and teens, I'm assuming. So we don't have any categories here that are specifically in the guided search that are specifically for teens. So I can use the keyword search and I want to see what shows up. I'm not exactly sure. I remember once I searched for it and maybe there are 10 hits or 7 hits. So if I search for teen, just the word teen. Okay, I get 6 results. Some of them are very obvious. So teen line, so that would obviously show up. Teen parent connection, of course. Henry Hyde Resource Center has teen parenting program or expectant parent program. Alive Center Naperville. Others show up. So family focused DuPage, for example, showed up when I look for teen services. Let's click in there. Let's see what really is in there for teens. I'm just curious. Again, yes. So you see it here. Within the description, it says provides programs for parents of young children, pregnant teens, and teen parents. So yeah, so there's information there that should be relevant as far as I can tell. But we don't see a whole lot. And one of the things that you will notice about DuPage CRIS, I'm going to go back to the home page here. And for those of you who have used resource databases such as 211s, you're used to that. A lot of 211s and similar databases for social services, they will include something like a drop down in the database where you can filter your searches. So for example, for those of us, we're very used to shopping online these days, right? So you use Amazon or you use some other website where you can choose, yeah, I'm looking for shoes for girls, or I'm looking for hats for boys ages 6 to 12, whatever it may be. It filters the results accordingly. In DuPage CRIS, we don't have a filtering system for target populations. So you're unable to define conveniently in that way for the population that you're looking for. You're only looking for women's services or for seniors. You notice that we don't have a category for seniors. We do have one for veterans. We don't have one for seniors. And that's something to be aware of. That's where you have to get a little creative right now with keywords, given how DuPage CRIS is structured today, at least on the public side of things. If you're somebody looking for services or a provider looking for services for your clients, that's important to remember. I can show you a couple of examples where you can use keywords in conjunction with the guided search to better refine your searches. I can show you that, and so you have a little bit more in your arsenal. But that's important to remember, that we don't have that filtering system. So seniors, for example, this is a very common question. Why don't you have a guided search option for seniors? And I will stand corrected if somebody would enlighten me otherwise. But a lot of times the services that seniors require, like housing, in-home care, etc., a lot of times they're also the same as for the general population too. So it's very difficult to differentiate, or in other cases, we'll end up duplicating resource records in the database. What's showing up under seniors is also showing up elsewhere, and that makes it difficult to manage. So again, I showed you that keyword search option. So in the resource records themselves, we'll try to specify, yes, this is for seniors, or it's for those who are 65 and older. And also, I should put this out there. Recently, I attended an AIRS conference last week, and we were talking about the use of terminology, right, with seniors. And we also want to, I think there is a push or encouragement to use older adults as opposed to seniors. So I don't want to be offensive to anyone. I apologize. We don't obviously think that way. When we say seniors, we just mean those who are 65 years and older. That's what we mean. Just as a disclaimer for you right there. So I want to show you an example of how you can use guided search in conjunction with a keyword to get around some of the difficulties of finding what you're looking for. So say I'm looking for substance use services or counseling. Let's look for counseling. So I'll click on mental health. That should have counseling services. Now, it does have adolescent youth counseling. So right off the bat, there is a category that already defines that this is for adolescent and this is for youth. So that should be fairly easy. But if I clicked on abuse counseling, for example, so let's click on that. Again, I don't know what's going to show up. It should be interesting to see whether anything shows up at all. So right now, for abuse counseling, we have 10 hits in the database right now. You can click on add a location and other options. You can click on this tab right here. And here you can define your search a little bit further. So I can click on keyword. So let's click on keyword. And I want to add senior. I'll do that. No, sorry. Actually, we're looking for adolescents or teens. Let's look for teen. I don't know what's going to show up. So added the word teen to this guided search. Remember, I didn't add any other criteria. The service codes are already added. Notice this is the tagging that I mentioned to you before. So it uses a combination of words and these alphanumeric codes from this taxonomy tree. I'm going to update my results. Remember, there were 10 results. I don't know what's going to show up if I update it. Nothing showed up. So none of the abuse ones or abuse counseling records have the word teen in them. That does not mean that they don't serve teens, but right now, as the information is there, maybe the word teen isn't in any of the records. If it should be, that's something we want to know. That's something we want when we do those annual reviews. That's what we implore our provider partners that let me know, should we define this, should we redefine that information so that it's conducting better search so that people are directed to you more appropriately, more efficiently, and they should go to you. So we can add that keyword so then that will show up. That's why this is important. That's why the information in the description section, for example, or in the service details is very important. If we don't have a service term that has teen in it already, and it doesn't. So that's where we have to get creative. Let's go back to the home page. Let's do another search. If I wanted to do like one of the areas which has been a little tricky, recently we updated a group of records in the database for school refusal programs. So when I was doing that, I noticed that in the taxonomy tree, in the service tree, I couldn't find like a standalone service term for school refusal. I wasn't able to find it. So I was able to find truancy counseling, but truancy counseling isn't exactly school refusal. School refusal, if I'm not mistaken, fell more under adolescent and youth counseling. It is sort of like a subcategory. It's part of that counseling. So I had to get creative and add that to resource records and add that school refusal at punch in school includes school refusal program or service in the service details, hoping that if people are looking for school refusal, it's showing up. But again, we're still working on that. We're trying to refine that because I took out all the truancy counseling service terms and I'm trying to update it with the school refusal in the details. The reason why I blabber about it again is I'm trying to tell you how this really works and how we go about tagging resources accurately and how then you would look for services or appropriate service providers in the database. I want to show you a couple of tools that you can use that would benefit you. So if you look at the top, you'll see something on my account. It's obvious. That means there's probably a login page of some sort. You can create a user account here. It's for free. It doesn't charge you any money. And it's very simple too. It's just name, your email address, password, done. So once you do that, there are certain advantages. Whether you are a member of the community who is using CRIS for services that you need, or you're a provider and you have clients, you have patients, etc., and you want to sort of customize searches for them, or like save or bookmark certain providers so it's quick access. You can do that using your My Account. So let me just log in. So I'm just gonna, if the password is wrong here and you click on login, it'll just take you back to the home page. Just letting you know that a lot of people like experience that, and I've heard provider partners email us saying, I do this and it just takes me back to the home page. That's probably because your password is probably wrong. Just letting you know. So you log in. This is your home page. Once you log into DuPage CRIS, you can look for providers here, right? You can also click on add a new resource record. So if I click on that, say that, remember I talked about how if you see a provider who should be in here and it isn't, you can let us know. You can add that provider, you can request that provider or organization for a new record here. And you can type in your name, whoever you are, whether you're associated with them or not, you can specify. And then you enter all the information, the required information, the name, a description, a basic description of what they do, Hopefully you're providing us with the website, intake process, program fees, etc. Eligibility, all that information you fill in. Hopefully you're giving us the address and the phone number at least, whatever you have. And then you click on submit record. That information then gets submitted to us, and then we can review it, assess it, and see if we can include it in the database, right? Let me go back to the home page, my account page rather. You notice here there's something called manage my resource groups on the left-hand side. So I can click on manage my resource groups, right? And then I can create a new group. What could this group be? Well, it could be anything you desire. You can customize a group of resource records for yourself based on exactly what you need or what your client needs, and you can save that. So let's just create a record for illustration. I don't know. Resources for teens, or yeah, resources for teens. That's fine. So save the group. Again, this is just an example. This doesn't have to be, I'm just going through the mechanics of it, so then you can use and do whatever you want. So let's go back to the home page, or actually search for something here. You can search for something here, by the way, but I'm going to go back to the home page. And remember, I'm logged in. You have to be logged in for this. So I know that I'm logged in. And I'm looking for resources for teens. It could be various resources here. So say I'm looking at education. Okay, education. Well, GED. Okay, GED. Then I say, all right. Oh, so there are a few. So there's 3 that's showing up. Okay, College of DuPage. I'll include them. I want to keep track of this record right here. Let's assume that I've already looked at it and everything. Then I go below. Notice here, select a group. The drop down, click on resources for teen. We just created that. Add to group. Okay, done. So I'm assuming it added properly. Just to check, let's go back to my account. Right. Click on manage my resource groups. Resources for teens. Let's click on that one. Voila. So you see it added that record. It's fairly simple, but it's convenient. So I mean, hopefully you get an idea of how you can then customize this. You can add whatever providers you need that are in there. There could be situations where you have clients coming in or patients coming in, and they sort of fit a certain criteria. These are the challenges that they have. These are the things that they are struggling with. This is what they need help with. And oftentimes you find yourself sending them to A, B, and C. Almost like it's like second nature. Yeah, here's the phone number. Give them a call. They'll help you. So if that's the case, this might be useful for you. You can just create a saved search in your managed groups, or encourage your clients or your patients to do the same. And then they can just, click on that, go to resource group. They don't have to find or look for a provider again and find their phone number, etc. They have it saved. So they can just log into an account. Doesn't matter where they go. DuPage CRIS doesn't have an app version, by the way, but it's very, very user-friendly on smartphones. So it doesn't have to be on a computer. It can be on your smartphone too. It's okay. So you can then go into your my resource groups or manage my resource groups, click on your resource group, and just access them that way. Very convenient. So you can use that as you see fit. One of the things I did forget, I want to go back to that. So you click on homepage again. I showed you an example where I used a keyword to define a search, or further refine a search rather. You can do the same for with other things, with other criteria as well. So let's click on mental health again. Again, I'm not assuming, I don't really know what's going to show up. So if I click on mental health facilities, right? So this will show that 24 hits. Now, if I click on add a location and other options, I can actually define a physical location. Maybe I need somebody within or close to where I am. So say if I put in zip code, right? If I say within 15 miles of the zip code, right? I've identified that. If I update my results, now it gets 16 results. Again, this should be very obvious or very simple, but I'm just trying to illustrate some of the options that are available to you to refine your search, to look for something that's specific to what you need or your client needs, and go that way. There might be times, again, when you are struggling to find something that you expect to find. Keywords not working, the guided search is not working. There's another option you can use. So this is not something that's required most of the time. For the vast majority of cases, especially with the community that we serve, we say that, you just use the guided search option, right? This is the easiest way. Go about this way. Yeah, you need what you need. You know what you need help with. You click on that and you just follow the prompts, and hopefully you're connected to a provider. However, you can get creative. So here on the top, next to home, you have something, you have search. So it's a drop down. You have advanced search, common searches, which is what we do most of the time, default. You have advanced search, but you also have the service tree. So if I click on the service tree, this is that alphanumeric taxonomy terms. You see, basic needs falls under B, consumer services falls under D, so on and so forth. And it shows you for basic needs, how many providers do we have in the database right now that are tagged with basic needs terms. So you can click on those, or you can define a service term here in this keyword. So you can look for, so say if I look for tax preparation, right? Let's see what shows up. Search the tree. I'll search the tree. So these are the website, the database is identifying 3 service terms that they understood to be tax preparations. Is tax preparation assistance, federal tax collection agencies, and life skills education, for whatever reason, right? And each of these, as you notice, they have a alphanumeric taxonomy code. If I clicked on view these providers for tax prep assistance, click on view these providers, it gives me 13 hits. So these are providers that have, tax prep assistance, some sort of tax assistance tag or tax assistance added to them. And you can go that way. This is another option you have to search for resources in the database. This is the taxonomy tree is not private, it's public information. So you can go in there and you can search for resources that way as well, right? So this is just an overview of DuPage CRIS that I wanted to provide. We can do so many examples. We can deep dive into a lot of different scenarios, but I just wanted to give you the basic tools using your resource groups, using the advanced search options, refining your searches, combining keyword and guided search to find what you're looking for. And most importantly, I wanted to let you guys know that you can you have the power to let us know if something should be there and you don't see it. We welcome the community, and this is the only way it works is if you guys let us know what should be there and what shouldn't. Before I close and open it up for questions, I do want to just hold on. Becky, are we seeing the presentation right now?
Yes.
Okay, that's fine. Just sharing some basic information. So this is the phone number for intake and referral at DuPage County Community Services. This is the team that we work alongside. For those, we understand that sometimes you just need to speak to somebody, or your clients, your patients need to speak to someone, and they can help navigate the system and give them referrals to the resources and the services that they need. They can call this number 630-407-6500. The staff there, they also use DuPage CRIS to find resources and provide referrals. If you're interested in volunteer services, DuPage CRIS doesn't list volunteer services, so there's a volunteer portal that takes you to Giving DuPage, which is one of our partners. So that's there on the homepage, and just my contact information. If you have any questions we were not able to cover today, you have specific questions, you are more than welcome to drop me an email, and I would be happy to reach back. This is our help desk email. So if I'm not responding, one of our team members will respond keep in mind our team is very, very small. That's why we are working around the clock like elves in Santa shop to keep this resource record up to date. There are only really two of us working on it at any given point in time, or one and a half of us rather. We really appreciate the feedback from the community and from our provider partners so that we can keep these things up to date. I just want to say thank you for your time. I'll open it up if there are any questions, or if there's anything else, Becky, you want to, if there's anything in the chat, maybe.
Yeah, we addressed the one question in the chat about what you should do if you don't have, if you see something that should be in there that isn't in there. So it's again, just by emailing that community point at dupageco.org. I will put up a slide for the evaluation while we take questions. So if you have any questions, put them in the chat or unmute yourself, and I'll pull up the slide to complete the eval.
Cool. Yeah, there's also, in addition to, thank you, Becky, for mentioning the email again. There's also, as I showed, you can just submit add a new resource record if you want to do that. You can do that as well. And then the information is submitted to us on the back end and review it. You'll notice in DuPage CRIS on the top, there's also the inclusion policy. Again, that's public information. So the inclusion policy details who can be included in DuPage CRIS and who can't, and why you won't be. And there's an appeals process as well. If you don't agree that, oh no, I should be included, you guys didn't include me, that's horrible. So there's an appeals process as well, so you can fill that out.
Perfect. All right. I'm not seeing any questions in the chat. Anyone have any questions they want to ask live?
While we wait for that, I do want to point out that I mentioned parity projects. So right now, actually, coincidentally, we are focusing, one of my projects is for mental health and substance use resources, focusing on teens and adolescents in DuPage County. That's something we're developing. I've found several providers who I have found on the internet and through community engagement that probably should be in CRIS and haven't been added yet, or we haven't found them before. So we are actively assessing them and including them as we speak. So that's a project for this year, actually. So it's quite, I think, appropriate that we did this training today, because that's a group that's a area we're focused on right now.
Yeah, Tariq, my name's Kathleen. I agree. The resources for teens. I have a friend of mine with a teen that just got out of treatment in Rockford. She returned to North Aurora and has Medicaid and needs like family counseling, and is, on her end as a mom, she's going through struggles, and the wait list for the Medicaid resources are long, and she's struggling. So
no, absolutely, Kathleen. You raise a good point. This is something we've noticed. Like I showed you that the data report that we did, a lot of times we notice people looking for this and counseling and therapy. And I think it's no surprise that in the COVID era, that just spiked up. People are just really struggling with these issues. And so that really prompted us that we need to focus on this, especially given I think even before COVID, I think when I think Becky, you'll recall, I think it was this February 2019, was it, or 2020, when we did that training at the health department, and we were about to focus on medical service providers and schools, etc. And then all hell broke loose. So we're just trying to pick it up again. We're trying to go back there and see if we can start to build. So yeah, we fell behind a little bit, understandably, but hopefully we're back on track. So yeah, Kathleen, I agree with you. Thank you for your input there.
Yeah, we got a question in the chat. Chris wants to know, if someone calls the phone number, can they leave a message if they can't reach someone during work hours, or if it's like after hours? Do you know? I don't know the answer to that.
I believe you can leave a message. I think so. I'm 90% sure. Ironically, I don't call that number ever because I just walk up to the front desk if I have a question for them. But I think that's a good question. I think you can leave your phone number. Remember that you are welcome to email them as well. So I didn't have the email there. So it's CS programs @dupageco.org. I'll type it up here as well. CS programs at
I got it. in the
Thank you,
chat.
Becky.
Yeah.
Yeah, so that's the email address for community services intake and referral team. If you end up forgetting this one, you can also email me, the community point at dupageco.org. I shouldn't say me, I should say the DuPage CRIS team, but I'm checking that most of the time. If you're not able to reach somebody, you want to talk to someone, you can email us there. I'll forward it to the intake and referral team so that they can then reach back out to you. That much I can do for you, for sure.
Sounds good. All right, so I think we're gonna end. I need to